So, what are the special considerations that you try to like see when you treat patients with cancer?
Well, it really depends on what stage of treatment they're in.
Mm-hmm.
So it if they are in current active treatment, then you really have to um, be in close contact with a physician to make sure that your goals
Mm-hmm.
is in line with the oncologist's goals,
Mm-hmm.
because it is important to be functional, but sometimes if there is joint mobility that needs to be increased, like the neck or the shoulder, then you have to make an effort to focus on those things. If
Mm-hmm.
they're preparing them for surgery, then you need to make sure that you're keeping the swelling down.
Mm-hmm.
But if you're seeing a cancer patient that's having long-term side effects,
Mm-hmm.
I would say that the physical therapy there is a little bit more similar than the usual.
Mm-hmm.
So you keep it functional based. You
Mm-hmm.
always want to just keep it functional based and patient goal oriented.
Mm-hmm.
Some of these patients, going through cancer and cancer treatment, they're amazing. They're just really, they're warriors. So it's really important to figure out what they want
Mm-hmm.
for the rest of their lives, and sometimes you have to ask the questions in
Mm-hmm.
order for them to figure it out themselves,
Mm-hmm.
because they won't specifically say it outright. So you're kind of like interviewing them. It's like
Mm-hmm.
motivational interviewing them and encouraging them to really plan for their future while they're dealing with the long-term side effects. So I guess it's functional based, but not just on a single function. You're thinking more like, okay, 3 months, 6 months, a year
Mm-hmm.
from now, what do
Mm-hmm.
you feel like you want to be doing, as opposed to our normal, orthopedic conditions.
Right.
Your goals are a little bit, closer to the present.
Mm-hmm. So you've talked about motivation in having cancer is a lot to deal with. So how do you motivate your patients that you're seeing in performing those activities and performing physical therapy? Probably with some of them in the back of their mind, they're unsure of the future. So how do you deal with that?
You listen.
Mm-hmm.
That's number one with cancer rehabilitation, is you listen, because most often when they see an oncologist, they're done in 15, 30 minutes. They're done with their visit.
Mm-hmm.
And there are resources out there, online. There's resources, in brochures, but I still think it's lacking the area where these patients can just talk about their cancer and
Mm-hmm.
what they feel about it.
Right.
And that's where we come in, because when I ask them, oftentimes when I see a first patient, my first question would be, um, well, after are you having pain and all those things? And we talk a little bit about their history of their cancer. But my favorite question would be, how do you spend your day?
Mm-hmm. Okay.
Because like what time in the morning do you start your day? Do you eat breakfast first? Because if they can give you that information, then you can really figure out which activities they're gonna they'll be having the most difficult time.
Mm-hmm.
Because when you ask them what's difficult for you, they'll say everything.
Mm-hmm.
Everything is difficult.
Right.
Going to the bathroom. With gynecological cancers, you'll have problem in pelvic floor.
Mm-hmm.
So it's important that you have a little bit of background of that as well.
Mm-hmm.
But really, knowing what their day is like is important. You're kind of like, you're investigating without seeming, I guess, too
Nosy.
cozy. Exactly. Thank you. That's what I'm looking
Mm-hmm.
for. And then they can kind of look back in their day, throughout, and look back at their day and think, oh yeah, you're right. I am having trouble there.
Mm-hmm.
So it's really awareness and having that respect for each other, because
Mm-hmm.
you have to gain their trust. Otherwise, if you say you're tired, but we need to exercise, they're not going to do it.
Mm-hmm.
They won't
Right.
come back to you. I'm tired. I don't want to deal with it. But
Hmm.
you have to gain their trust and say, I understand you're tired, but if you just rest, it's not going to go away.
Hmm.
So I really think conversational interviewing is very important in cancer rehabilitation. And sometimes I spend a whole hour just interviewing them and giving them little bits of tips,
Hmm.
energy conservation techniques, when to perform their diaphragmatic breathing, when to get up from the bed, when to lie down.